Okay, picture this. You're up at like 2 in the morning
Oh, yeah.
with a baby who just will not stop crying. Like you've tried everything.
Oh, I know that feeling.
Feeding, diaper changes, rocking.
Yeah.
You've even checked for like, a rogue hair wrapped around a tiny toe.
Yep.
Nothing seems to work.
Right.
If this sounds painfully familiar,
Uh-huh.
you might be dealing with colic.
Colic is, it's like baby crying, but amplified.
Yeah.
It's more than just like a few tears here and there. We're talking hours
Oh, wow.
of intense, like inconsolable crying.
Oh,
And
God.
it's actually pretty common. Some research suggests it affects up to 40% of babies.
40%. Wow, that's a lot of crying baby.
Yeah.
So, like, what exactly is colic? How do we know if it's like just a fussy phase or something more?
So technically, colic is defined as crying for more than 3 hours a day,
Okay.
3 days a week, for at least 3 weeks.
Okay.
It usually starts around 2 to 3 weeks of age,
Okay.
peaks at 6 weeks,
Gotcha.
and for most babies resolves by 3 to 4 months.
So it's like a crying marathon with a thankfully predictable finish line.
Yeah, you could say that.
Yeah.
And while it's like incredibly stressful for parents,
I bet.
it's important to remember that colic itself isn't an illness. It doesn't mean your baby's in pain or that you're doing anything wrong.
Right.
They're just expressing themselves the only way they know how loudly.
Yeah, that's reassuring.
Yeah.
But I have to ask, if they're not in pain, why all the drama? What's going on in those tiny little bodies?
That's the million-dollar question, and
Yeah.
unfortunately, there's no single answer.
Yeah.
But there are some fascinating theories out there.
Okay.
One thought is that it's all about digestion.
Okay.
So think of a brand new digestive system trying to like navigate the world outside the womb.
Yeah, it's like trying to learn a new language, except instead of words, it's burps and gas.
Exactly, and sometimes those burps and gas get stuck,
Oh, no.
leading to discomfort.
Yeah.
And you guessed it, crying.
Yeah.
Some researchers believe colic could be related to babies struggling to digest certain proteins in breast milk or formula,
Interesting.
or maybe even having trouble passing gas.
So basically, it's tummy troubles on a tiny human scale.
Precisely.
Yeah.
And then there's the sensory overload theory.
Okay.
Imagine going from the peace and quiet of the womb to a world full of like bright lights, loud noises,
Right.
and new sensations.
Yeah, talk about a culture shock. I'd probably cry, too, if I had to deal with all that.
It's a big adjustment.
Yeah.
Some babies might simply find this sensory onslaught overwhelming and cry as a way to cope.
That makes a lot of sense.
Yeah.
But are there other things that could be contributing to this, like, colicky symphony?
Absolutely. Temperament, that plays a role too.
Oh, okay.
Some babies are just like naturally more sensitive and
Yeah.
have a harder time self-soothing.
Right.
Like it's like, some of us are built for roller coasters.
Yeah.
And others prefer a gentle carousel ride.
I get that, yeah.
Right.
So some babies are just, like, wired to be a little more sensitive.
Exactly.
And I imagine, like, feeding challenges could also contribute to the crying.
You're spot on.
Yeah.
Things like latch difficulties during breastfeeding,
Mhm.
swallowing air, or even like lactose intolerance
Oh, yeah.
can make feeding uncomfortable,
Right.
leading to, more crying.
More crying, yeah.
More crying.
It's like trying to solve a mystery. So many different factors could be, like, playing a part.
Yeah.
And I've heard some, like, buzz about the gut microbiome being involved, too.
That's a really interesting area of research.
Okay.
Scientists are discovering that the balance of bacteria in the gut
Yeah.
could play a role in colic.
Wow.
It seems certain types of bacteria might contribute to gas
Yeah.
and digestive discomfort, leading to those like epic crying spells.
So it's a whole, like, microscopic world at play.
Uh-huh.
Okay, so we've got a better understanding of what might be, like, behind those tears.
Right.
But what can we actually do about it?
Yeah.
How do we, like, help these little ones
Right.
and maybe get a little peace and quiet ourselves?
Let's talk strategy.
Okay.
One approach that's been like incredibly helpful for many parents
Yeah.
is Dr. Harvey Karp's 5S's technique.
Okay, I've heard of this. Fill me in on these magical S's. What's the first one?
Chest up is swaddling.
Okay.
Imagine wrapping your baby smugly in a blanket like a little burrito.
Yeah.
It recreates that feeling of being held tightly in the room,
Right.
providing a sense of security and comfort.
Back to the good old days. Makes sense why that would be soothing. What's next?
Next is shushing.
Pushing. Okay.
Think about the sounds babies hear in the womb.
Uh-huh.
It's not exactly silent in there.
Right.
White noise, like the sound of a vacuum cleaner or a fan, can like mimic those womb sounds
Oh,
and have a calming effect.
I'm starting to see a theme here, recreating the room environment.
Yeah.
What's the third S?
The third S is swinging,
Okay.
gentle rocking or swaying motions.
Yeah.
Whether in a swing, a
Mm-hmm.
carrier, or your arms can be incredibly soothing for babies.
Okay.
Again, it's all about mimicking that constant motion they experience in the womb.
So it's like a mini dance party without the disco ball.
Exactly.
What about the fourth S?
The fourth one is a side or stomach position.
Okay.
Now, this one is important. Always supervise your baby when they're on their side or stomach,
Yeah.
and make sure they're placed on their backs for sleeping.
Well, of course, of course.
But holding them on their side or stomach while they're awake can sometimes help soothe them.
Got it. Safety first. So holding them on their side or tummy while they're awake can help. But back to sleep goes the baby.
Exactly.
What's the final S?
Last but not least, we have sucking.
Sucking. Okay.
Whether it's a pacifier or breastfeeding.
Right.
Sucking is a natural way for babies to self-soothe.
Okay.
It triggers a calming reflex and can help them, relax.
So the five S's: swaddling, shushing, swinging, side or stomach position, and sucking sound like a pretty solid plan.
Right.
But what about those digestive troubles we talked about?
Yeah.
Are there other things we can do?
Absolutely. Frequent burping is key.
Okay.
Those little air bubbles
Yeah.
can cause a lot of discomfort.
Burp it up, baby. And what about those tummy troubles? Any tips there?
Gentle tummy massages
Okay.
can help move things along and relieve gas.
Okay. Yeah.
And if you're formula feeding,
Right.
you might want to chat with your pediatrician
Mm-hmm.
about switching to a different formula.
Okay.
Sometimes a change in formula can make all the difference.
A formula switcheroo. And what about breastfeeding moms? Any tips there?
For breastfeeding moms, certain foods in your diet
Yeah.
might be affecting your baby's digestion.
Right.
But, and this is important,
Okay.
always talk to your pediatrician before making any major changes to your diet.
Got it.
It's about finding a balance that works for both you and your baby.
Yeah, no rogue dietary experiment.
Right.
So aside from the five S's and addressing tummy troubles, are there any environmental changes we can try?
Creating a calm and peaceful environment can definitely help.
Okay.
Dimming the lights, turning down the noise, and avoiding too much stimulation.
Yeah.
Especially during those peak crying hours.
Yeah.
Can make a big difference.
That makes a lot of sense. And I imagine getting out and about could help too.
Movement can be incredibly soothing.
Yeah.
Car rides, walks in the stroller, or baby wearing.
Right.
All these activities can help calm a fussy baby.
It's all about mimicking the motion of the womb. Genius.
Exactly.
Yeah.
And there's one more thing we need to discuss. Probiotics.
Ah, yes, the gut superheroes.
Exactly. Some research suggests that probiotics, especially a specific type called Lactobacillus reuteri,
Okay.
might help ease those colic symptoms
Yeah.
by promoting a healthy balance of bacteria in the gut.
But again, pediatrician consultation is key before starting any supplements, right?
Absolutely.
Yeah.
And speaking of consulting experts,
Mm-hmm.
let's talk about when it's time to seek help.
Okay.
If the crying seems unusually intense,
Right.
goes on past 4 months,
Okay.
or you notice other symptoms like fever,
Uh-huh.
vomiting, or weight loss,
Yeah.
it's time to call the doctor.
Absolutely. Better safe than sorry.
Exactly. Colic can be a tough phase.
Yeah.
But remember, you're not alone.
Right.
Lean on your support system,
Right.
and don't hesitate to reach out for help when you need it.
So true. And remember, even though it feels like it will never end,
Yeah.
this phase will pass. You've got this.
And as we wrap up our deep dive into the world of colic, I want to leave you with a thought-provoking question.
Okay.
Could colic be a baby's way of communicating their needs in the only way they know how?
Wow, that's a really interesting perspective.
Oh.
Maybe it's not just crying, but a tiny human's way of saying, hey, I need something, and I need it now.
Yeah, it really makes you think, doesn't it?
It does, and it reminds us that even though it's challenging, this phase is temporary, you're doing a great job. And eventually, those cries will turn into coos and giggles.
That's right. And remember, you are not alone on this journey. There's a whole community of parents who've been there, done that, and survived to tell the tale.
So true.
So hang in there. You got this.
That's a great note to end on to all the parents out there battling colic.
Yeah.
You're doing amazing. Remember to take care of yourselves and lean on your support system.
Exactly.
And even though it feels like forever, this too shall pass.
It will.
Yeah, it really does. It puts things into perspective.
It does.
We often think of crying as just like a negative thing.
Uh-huh.
But maybe, like, it's more than that.
Exactly. It's their way of communicating, of
Right.
letting us know they need something.
Yeah.
Even though it can be incredibly frustrating,
Yeah.
it's like a sign of their healthy development.
That's a good way to think about it. So for all those parents out there feeling overwhelmed by colic,
Mm.
what's like the one thing you'd want them to remember?
I'd say, remember that you're not alone.
Right.
Millions of parents have navigated colic, and you will too.
Yeah.
It's a phase, and it will pass.
And in the meantime, there are things you could do to help both your baby and yourself. We talked about the 5 S's. Creating a calm environment,
Right.
addressing any potential feeding challenges, and even considering probiotics.
Exactly.
And don't forget the power of self-care.
Yeah.
Taking care of yourself is not selfish. It's essential.
Absolutely.
Ask for help.
Yeah.
Take breaks when you can.
Right.
And remember to breathe.
So important.
That's so important. You can't pour from an empty cup.
Right.
So to all the parents out there riding the colic roller coaster, hang in there.
You got this.
You're doing a great job. And eventually those cries will be replaced with giggles and coos.
That's right.
Until next time, happy parenting.